Mayo's Community Counselling Services, a $112,500 funding boost for families. Imagine a community where families can access essential mental health support right at their doorstep. This is becoming a reality for many in County Mayo, thanks to a significant funding boost of €112,500 aimed at enhancing community counselling services. Minister of State Alan Dillon has announced that 4 dedicated community and voluntary organizations will receive this funding, which is set to transform the lives of children and families in the region. This financial support is not just a number, it represents a lifeline for many. Minister Dillon expressed his enthusiasm, stating, "I'm delighted to see this funding that will help provide community-based counseling, psychotherapy, and a range of therapeutic interventions such as play therapy, creative arts therapy, bereavement support, and systemic family therapy right across the country. These services are crucial, especially in times of emotional distress, and they play a vital role in fostering resilience among young people and their families." The allocation of funds is as follows. Ballina Family Resource Centre will receive €8,500. The Family Centre in Castlebar is awarded €66,700. Counselling Centre will benefit from €32,250. And Westport Family Resource Centre will get €5,000. Each of these organizations is committed to providing essential support tailored to the unique needs of their communities. Dillon further emphasized the importance of these services, noting this funding will go a long way to help children and young people in Mayo to get timely access to counseling services in their own communities. These services are absolutely vital to so many families in our communities, and I'm particularly delighted to see funding for the Family Centre in Castlebar, which provides a fantastic service to the community. On a broader scale, this initiative is part of a larger commitment, with €1.5 million allocated annually to 73 community and voluntary organizations across the country that deliver these essential services. It's worth noting that this funding has now been regularized. Previously, it was sourced from the Dormant Accounts Fund, but it will now be managed through the budget of TUSLA, the Child and Family Agency. The Fine Gael Party acknowledges the tireless efforts of those who operate local community counselling services, and Dillon expressed his satisfaction in seeing Counselling Centre receive the crucial funding it deserves. But here's where it gets controversial. While this funding is a step in the right direction, some may argue that it still falls short of addressing the broader mental health crisis facing many communities. Are we doing enough to support mental health initiatives? Or is this merely a Band-Aid solution? We invite you to share your thoughts in the comments below. Do you believe that more comprehensive measures are needed to ensure mental health support is accessible to all? Government funding for community counseling services in Louth. Imagine a world where every child and family has access to the support they need to thrive, regardless of their location or financial situation. But here's the harsh reality. Many communities lack the resources to provide essential counseling and therapeutic services, leaving vulnerable individuals to suffer in silence. That's why the recent announcement of €56,000 in government funding for 2 community-based counseling services in Louth is a beacon of hope. Dundalk Counselling Centre and Connect Family Resource Centre will receive €46,000 and €10,000, respectively, as part of a €1.5 million national funding package allocated to 73 community and voluntary organizations. This investment will enable these services to increase their counseling and therapeutic capacity, reduce waiting lists, and provide support to those who may otherwise be unable to access services due to cost or location. But what's truly groundbreaking about this funding is that it's no longer a one-time grant from the Dormant Accounts Fund. Instead, it's been regularized and will be delivered from the annual budget of TUSLA, the Child and Family Agency, ensuring a more sustainable response to the growing demand for child and adolescent therapeutic support. The decision to regularize funding was informed by a detailed survey of organizations that had previously received funding, as well as close engagement with TUSLA's area offices to assess need and guide the allocation of funding. As Minister for Disability, Children and Equality, Norma Foley TD announced the funding, she emphasized that these services are deeply responsive to local needs and play a vital role in delivering therapy to children and young people when they need it most. But here's where it gets controversial. Some might argue that 1.5 million euros is just a drop in the ocean compared to the vast need for counseling and therapeutic services across the country. Others might question whether the funding is being allocated effectively, or if there are other, more pressing priorities that should be addressed. And this is the part most people miss. The funding provides a range of therapeutic interventions, including play therapy, creative arts therapy, bereavement support, and systemic family therapy, which can have a profound impact on the lives of children and families. So we have to ask, is this funding enough, or is it just a starting point? Should we be investing more in community-based counseling services, or are there other solutions that could have a greater impact? We want to hear from you. What do you think about the allocation of funding for community-based counseling services? Do you think it's a step in the right direction, or is there more that needs to be done? Share your thoughts in the comments below. €20,000 funding boost for community counseling services in Wicklow. What if we told you that over €20,000 could transform the lives of countless children and families in Wicklow? This isn't just about numbers. It's about real people, real struggles, and the urgent need for accessible mental health support. But here's where it gets controversial. Should mental health funding rely on government budgets or alternative sources like dormant accounts? Let's dive into the details. 3 community organizations in County Wicklow have been awarded a total of €23,500 to expand their counseling and therapeutic services. This funding isn't just a handout, it's a lifeline for families navigating complex emotional challenges. The Sophia Counselling Centre in Kiltegan, the County Wicklow Community Partnership, and the Greystones Family Resource Centre will each receive targeted support to deliver critical interventions. For instance, Sophia Counselling Centre's €8,500 allocation will fund play therapy and creative arts therapy for children, while the County Wicklow Community Partnership's €10,000 will bolster systemic family therapy programs. Greystones Family Resource Centre's €5,000 will support bereavement counseling and parenting workshops. Wicklow TD Edward Timmins, a vocal advocate for community-based care, called the funding a game changer. He highlighted the shift from the Dormant Accounts Fund to a more sustainable model through TUSLA, the Child and Family Agency. This change, he argues, ensures long-term stability for services like trauma recovery, grief counseling, and family mediation. But is this new funding structure truly foolproof? Critics might question whether government-dependent budgets could face cuts during fiscal downturns, unlike the one-time Dormant Accounts Fund. And this is the part most people miss. The $1.5 million national budget for 73 similar organizations isn't just a statistic. It's a nationwide effort to decentralize mental health care. Imagine a teenager in Greystones struggling with anxiety, now able to access local therapists instead of waiting for months in a distant clinic. Or a family in Kiltegan learning to rebuild trust through play-based therapy. These are the real-world impacts of this funding. Yet a bigger question remains. Are we doing enough? With rising demand for mental health services and ongoing debates about funding models, should we explore innovative solutions like public-private partnerships or community fundraising? Share your thoughts below. Do you believe this funding allocation strikes the right balance, or are there gaps we've overlooked?